Studies reveal the easiest way to protect your eye health every day. Here's how. After so many years of talking to people about eye health, I wanted to try and distill down for you what are the highest return on investment ways to protect your eye health every day, and focus on what are the easiest things you can do right now to make the biggest difference. Because if you're like most people, you don't have a lot of time to spare, and so you want to focus on just the things that take the least time and have been shown to provide the most benefit. Hopefully, if you stay with me until the end of this video, you will find at least a few things that you can seamlessly add to your daily routines and enjoy a lifetime of better vision. For those who are new to the channel, welcome. I'm Dr. Audrey Tai, a board-certified and fellowship-trained refractive and cataract surgeon, an ophthalmologist, and cornea specialist. And of course, I always get a lot of questions from my patients about preventative health and taking good care of your eyes. So let's talk about what are some of the easiest and most impactful way to protect your long-term eye health and take good care of your eyes every day. My first recommendation is one of the simplest and also one of the most impactful. Spend more time outside. Studies show that children who spend more time outdoors have a lower risk of nearsightedness or myopia than children who spend more time indoors. There are many benefits of being outdoors for both children and adults, including reduced nearsightedness, stress relief, vitamin D production, and others. But many people don't spend enough time outside. I would recommend getting outside during daylight hours at least once every day with the whole family, and that brings me to my second high impact recommendation, which is wear your sunglasses. Always remember to wear your sunglasses when you're out in the sun. This one is very important for us here in this sunny Southern California, but it is also important no matter where you live. Wearing your sunglasses blocks harmful ultraviolet or UV light from reaching the important structures of your eyes. Exposure to UV light causes damage over time and can lead to cataracts, eye cancers, as well as sunburn and growth around the eyes. Many experts recommend polarized glasses to offer the best protection against the sun's rays and to reduce glare. If you would like to learn more on this topic, please subscribe and hit the notification bell so you will be notified about videos coming out soon on this channel explaining how to tell if your UV sunglasses really block UV and discussing polarized versus non-polarized sunglasses. The next thing to do is to make sure to take screen breaks and avoid prolonged screen time. Many of us have jobs or activities where we're staring at the computer screens or other screens for an extended period of time. And so it is very important to take periodic breaks from the screen. Prolonged screen time can cause dry eyes, blurred vision, headaches, and eye strain, as well as musculoskeletal pain and injury to the neck and shoulders. You may hear digital eye strain referred to as computer vision syndrome. The American Ophthalmological Association recommends using the 20-20-20 rule to prevent computer vision syndrome. Every 20 minutes, look at something at least 20 feet away for 20 seconds. One trick that I sometimes recommend is setting an alarm or using an app that reminds you to take a screen break every 20 minutes. Another thing to remember is that screen time isn't the only cause of eye strain. Reading a book up close for long periods of time can lead to nearsightedness or myopia, as well as eye strain and blurry vision. Just like for the screens, you should use the 20-20-20 rule and take a break from staring at the book every 20 minutes. And that brings me to my next tip to preserve your eye health is to exercise regularly. Studies have shown that regular full body exercise is essential for eye health as well. Regular exercise promotes vascular health, which is healthy blood vessels, and that is one of the most important elements in preventing glaucoma and diabetic retinopathy, which are two of the 4 most common causes of blindness in the US, according to the Mayo Clinic and the Department of Health and Human Services. You need to accumulate at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week. It is perfectly fine to get a combination of some amount of vigorous aerobic activity and some amount of moderate aerobic activity. That counts too. I should note that those were kind of the minimal amount, and those same guidelines that I mentioned do suggest that if you can get 300 minutes per week or more of moderate aerobic activity, then the health benefits will be greater. Regular exercise, including strength training and aerobic exercise, will also help you control your body fat and lower your risk of heart disease and certain cancers. So getting regular exercise is one of the highest return on investment ways that you can spend your time. Of course, if you haven't exercised for a while and you have health concerns, you should always talk to your doctor before starting a new fitness routine. Now that we know how important it is for eye health to get regular exercise, it should come as no surprise that nutrition is just as important. The foods you eat every day can improve your eye health. Eating foods rich in vitamin A, C, and E, beta-carotene, omega-3 fatty acids, lutein, zeaxanthin, and zinc can help cellular growth, lower eye tissue inflammation, and reduce free radicals that can damage your eyes. If you want to learn more about nutrition and eye health, I have many videos on this topic on this channel, and you can check out those videos. My next high impact recommendation, and I put this one in terms of the general population. But if you're a smoker, this is definitely number one for you, and that is to quit smoking and avoid smoking. In addition to smoking's well-known effect on cardiovascular health, longevity, and cancer, smoking also increases the risk of developing cataracts and age-related macular degeneration. You remember I said when we were discussing exercise that glaucoma and diabetic retinopathy are two of the four most common causes of blindness in the US? Well, cataracts and age-related macular degeneration are the other two. Studies have shown that cigarette smokers have up to 3 times higher risk of developing cataracts, and up to 4 times higher risk for macular degeneration. There is some evidence that smoking also increases the risk of glaucoma, diabetic retinopathy, and dry eye disease. Smoking increases your chances of getting diabetes, which is a risk factor for glaucoma and dry eye syndrome. It's more than twice likely in smokers as non-smokers. My ninth recommendation is also very straightforward, but surprisingly effective, and that is always wash your hands before and after touching your face or eyes. If you're one of the 45 million Americans that wear contact lenses, this is a very important recommendation for you, because around 1/3 of contact lens wearers develop complications, often infections. And 1 in 5 infections from contact lens use causes damage to the patient's cornea. Plus, washing your hands regularly provides the added benefit of significantly reducing your risk of viral illness, such as respiratory illness like influenza and COVID. Here's an experiment you can do at home. For just one day, keep a little note of every time you wash your hands throughout the day, and you might be shocked at how few times you actually do. If that is the case, then make it a point to wash your hands at regular intervals throughout the day, and you will likely see benefits in the long term. And my final high-impact way to protect your eye health easily every day is always make sure to remove face and eye makeup before you get into bed. Doing so benefits your eye health and can lower your risk of blepharitis or eyelid inflammation and infection. If you would like to learn more on this topic, please check out my video on harmful ingredients to avoid in makeup and 5 tips for safely applying makeup on eyelids and eyelashes. Well, that's it for this week's video. If you have learned something new, please consider hitting the like button and subscribing to my channel to support more informative content on eye health and surgery. You can also follow me on Instagram, Facebook, and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you for watching, and I'll see you in my next video.